name is Kristen Allen. Thank you, Jessica. I'm a Knowledge Translation and Implementation Coordinator with the Waypoint Research Institute, and I'm pleased to welcome you to today's Waypoint Talks session. Today, we will explore transformative climate action in mental health organizations. We'd like to start with a land acknowledgement. The Waypoint Research Institute is located on the traditional territory of the Anishinaabe, which include the Odawa, Ojibwe, and Potawatomi nations, the Haudenosaunee, Huron, Wendat, and Métis peoples. We acknowledge and affirm our commitment to improving relationships between nations and to improving equity for Indigenous communities residing in the central north region of Ontario. So welcome to Waypoint Talks. Waypoint Talks is a virtual webinar series that is offered by the Waypoint Research Institute, aiming to highlight the practical implications of research projects. We also have a complementary series, Waypoint Talks Building Your Research Toolkit, where we aim to highlight best practices used in mental health research, quality improvement, and program implementation. And these events are open to all who are interested in learning about emerging research, best practices, and clinical innovation. A few quick housekeeping notes. So this is hosted as a Zoom webinar. So we ask that you use the chat box and Q&A function to connect with the speakers and your fellow attendees. And feel free to add those questions in throughout the presentation because we will have dedicated time at the end for questions and discussion. The recording and slides will also be available post-event on the Waypoint Research Institute website. And we ask that you please complete our post-event survey. Sharing your feedback does help us improve our future Waypoint Talks events. There are also attendance certificates for professional development available, and we'll share how to access those at the end of the presentation. So now I'm very excited to introduce today's speakers. We're joined by Dr. Carolyn Holding today. She's a registered clinical psychologist with 12 years of experience delivering supervision and training and 20 years clinical experience. She is currently the Psychology Training Lead, Director of Training for the Waypoint Psychology Residency Program. Dr. Holding works in clinical research and training capacities at the Waypoint Center for Mental Health Care and at the Waypoint Research Institute. Dr. Holding completed her PhD in clinical psychology at Lakehead University in Ontario and her residency at the Norpic Residency Program. She contributes to climate activism, including in a professional capacity. We're also joined by Dr. Barna Konkali Thega, who joined Waypoint as a scientist practitioner in 2015 and has been an assistant professor in the Department of Psychiatry at the University of Toronto since 2017. He previously held a postdoctoral fellowship in the Psychology Department, Addictive Behaviors Lab at the University of Calgary, and was a lecturer of medical psychology at the Institute of Behavioral Sciences at Semmelweis University. Barna's current research and clinical interests include cognitive behavioral therapy for psychosis, as well as the system-oriented psychodynamic and nutritional treatment of mental disorders in general. So with that, I will pass you over to today's presenters.
Thanks very much, Christy. Yes, welcome to our presentation on transformative climate action and mental health organizations. As Christy mentioned, I work as a psychologist here at Waypoint, and I'm the training lead for the psychology residency program. In the past, I've also been a researcher with Waypoint Research Institute. My colleague, Dr. Bahana Konkalitega, will also be presenting. Our presentation is going to be in two parts. First, I'm going to focus on the ways in which, as mental health organizations and professionals, we can use climate protective practices to prevent and reduce further environmental damage. And the second part will be presented by Barna, and he's going to focus on consideration of pathways to adapting to climate change. To add to the land acknowledgement that has already been done, we wanted to acknowledge that the lands have been stewarded by Indigenous communities for thousands of years, and their profound relationship with the land, water, and ecosystems continues to this day. And we recognize the impacts of colonialism, including extractivist industries from which we benefit, have caused significant harm to Indigenous peoples and their territories. And as mental health workers, we stand in solidarity with Indigenous communities in their resistance to environmental and climate degradation. We're committed to educating ourselves on the intersection of environmental justice and Indigenous rights. So just as a bit of a background of my involvement in environmental and climate activism, up until a few years ago, I would probably describe myself as sort of passively concerned and a bit stressed out by the environment and kind of inclined to switch the radio off if stuff came on about it. I, some level, thought that, you know, the government's going to take care of things, and the impacts and concerns were well down the road, like, you know, 100 years down the track. My daughter was very involved in climate activism, and in a few years ago asked me to help her at a protest. So the premises of the protest was that we were imagining a time in the future where there had been a transition away from like fossil fuels to an environmentally friendly, a more environmentally protective way of being. And the action took place outside of Chrystia Freeland, the then Deputy PM's office. And in looking up pictures of Chrystia Freeland, I noticed I had a passing resemblance to her and I had a dress just like hers. So I pretended to be her and did a speech at this action. So following that, that action, I started digging around a bit more in environmental groups, and stumbled across a group, a UK-based group, Scientist Rebellion. And this group was essentially climate scientists who have been researching and advocating and recommending for years, but seeing their recommendations are not acted on. And so sort of took to activism as a way of responding to that. In their alarm, they've resorted to tactics that are based on actions from other social movements, including nonviolent civil disobedience. So they have chapters all over the world, including in North America, but they're particularly active in Europe. So just being exposed to that group spurred a significant shift in me, and I kind of went from being passively concerned to more of an emergency role mode, and I've since become very involved in a broad spectrum of ways. So through work-based involvement, volunteering, meeting with colleagues, so like with elected officials, and in private life as well. So I wanted to give you just a very quick primer and background. What we're seeing is that the status quo is not working. As you may know, global warming has very serious consequences. It's driven by CO2 emissions, and those are mostly produced by fossil fuels. They have increased exponentially since the Industrial Revolution. Global warming is destabilizing the climate, and this is already having devastating impacts, which are only going to get worse. There's been lots of international efforts to try to do something, but as you can see, even with these efforts, the CO2 emissions and global warming just keep marching on. We're already seeing the impacts, including in Canada, wildfires, heat waves, severe flooding, storms, hurricanes, extreme weather events. The wildfires in the 2023-24 seasons were the worst in history and extremely expensive. BC had a heat dome in 2021, 600 people died. We all remember just this last summer, just how many days there were heat warnings, and our clients and patients needed to stay inside because of that. And last year as well, Hurricane Fiona a few years ago in the Maritimes, that was the worst, most expensive extreme weather event in the history of Atlantic Canada. Cost $22 billion or more. So the impact of climate change is not just felt by the environment. There's substantial financial costs. it's not just the environmentalists who are paying attention and concerned. The insurance sector is also paying a lot of attention. 2024 was the unnatural weather events were extremely costly, and you can see this huge spike in insurance claims in 2024. Canadian insurance companies have begun to cut down on coverage or raise premiums for coverage of risk. Some insurance companies are withdrawing from high-risk areas altogether, making home insurance either too expensive or not even available in certain parts of BC, Alberta, due to repeated wildfires and floods that are occurring increasingly often. So in other words, our world needs climate action on all fronts, everything, everywhere, all at once. And that is a quote from Antonio Guterres, who is the UN Secretary General. And that includes in the health sector, in health organizations, and as health professionals and researchers. So moving back to thinking about what's driving climate change, so like in the particular kinds of greenhouse gases. So as I mentioned, carbon dioxide is the most prominent, comes from burning fossil fuels. Methane is also a contributor. Methane is produced by food waste in landfills, through agriculture and domestic livestock. There's also greenhouse gases from nitrous oxides, including from anesthetic gas, and CFCs, which are used in industrial applications, including metered dose inhalers. Everything that we use, including in healthcare, has an environmental impact. It's possible to even measure how much CO2 is needed for different health materials. For this mask, for instance. In fact, there was an artist, Maria Koich, who is a spatial artist. She constructed this illustration of the amount of medical waste from just one operation, which was her own operation. We can see how healthcare contributes so much to greenhouse gases. So why mental health organizations? Why should we care and get involved? 4.6% of Canada's greenhouse gas emissions are from the health sector. Our patients and people who are unhoused, people who are non-white, Indigenous, or from Black and low-income populations are particularly vulnerable, as are youth and elders. Health organizations are anchor organizations, meaning they have a lot of purchasing power, and they can really influence kind of cultural norms and system transformation. Our organizations are impacted by unnatural weather events and environmental degradation. This has funding implications. The pollution and climate impacts are costly in terms of health resources, but also in terms of needing to redirect funds to deal with all of the unnatural weather events. And there, in terms of accreditation standards, there's current and future accreditation standards relevant to ensuring that we are respecting environmental stewardship and delivering service in an efficient way. So what are the impacts of climate change on human health? There's all kinds of things, including impacts from air pollution, impacts from vector-borne diseases, allergies, in parts of the world where the climate's got so bad that there's massive crop failure or just unbearable heat. So we have environmental refugees. More locally, we have impacts from heat and heat stress. There's mental health impacts. So there's direct impacts. So, for instance, from PTSD, if you were caught in a severe weather event, depression, psychological distress, eco-anxiety, There's indirect impacts through needing to be displaced, food insecurity. Worsening physical health has mental health implications. There's cognitive behavioral health as well. There's including from in utero health exposure. Extreme weather events, extreme heat events are associated with high mortality among people with pre-existing mental health conditions, increased psychiatric admissions, increased risk of suicide, and increased frequency of domestic violence. So there are a lot of mental health and cognitive implications as well. And how about us as health workers and researchers? So I hope that I briefly made the case that the climate crisis is also a health crisis. But also we need to, as regulated, some of us are regulated health professionals, and it's embedded within our ethical codes. There's specific mention of environmental stewardship and within the ethical codes of psychology, of social work, where social workers advocate for the stewardship of natural resources and the common good of all people. Physicians do no harm. Nursing, there's 25 Code of Ethics for nurses that includes the guiding principle that they promote planetary health is essential to the global health and well-being of all living and non-living elements. And the pharmacy Code of Ethics is founded on the principle of beneficence and includes general statements that related to environmentally conscious practices. So many of us should reflect on our ethical responsibilities as professionals. Scientists have also done that. There's a growing movements away from neutrality to taking a more active role or more public-facing role in advocacy through organizations, for instance, such as Scientists Rebellion and Scientists for Global Responsibility. As health workers and researchers, we have a lot of collective power, there's a lot of us are concerned. Like one study found that 91% of people are concerned, at least somewhat concerned about climate change. So speaking up, you won't be alone, and that's been my anecdotal experience when I've talked to other team members and people here at Waypoint. Many people are really concerned. And this is also reflected in publications where there's sort of growing calls to action. No? Sometimes it's helpful when we're trying to decide where to even start, or what we can do is to reflect on the numbers of roles that we have within our lives, including our professional lives. So we have roles as consumers. So as health professionals, we decide whether we're going to buy or use stuff or not, what we eat at work, what we promote eating, whether we travel like by air. We're investors. We have pensions. We have our hoop pension. Waypoint has a board that has investments. Our various professional organizations, they have investments. We are role models within our communities. So how we consume, how we advocate, how we travel, etc., whether we're politically engaged. We are participants in our organizations and can have influence there. So our unions, our professional organizations, our employers, etc. And we also are citizens. And, we are seeing, and I guess I'm experiencing in real time, that elections have consequences. And that's important as private citizens, but also as health workers, to use our collective voice to advocate. So how are we going to do that? So it's bigger than you might think. It's not just about getting arrested or recycling. There's many other ways, although those are two possible ones. Just like through becoming more involved, you become more aware of greenwashing and other apparent solutions which perhaps aren't as impactful as you might hope. So if we're wanting to be kind of data-based, what are the biggest contributors within the health system as to greenhouse gas emissions and environmental degradation? As mentioned, the health system in Canada it contributes 4.6% of the total greenhouse gas emissions of the country. The Lancet published a study out of the UK which looked at the contributions of different parts of the health system to greenhouse gas emissions. And this helps us to understand some of the places where we can make changes, or we might prioritize making changes. As you can see, the most important focus in transforming the mental health system is cutting down on greenhouse emissions from the supply chain. And the largest part of that is pharmaceuticals and chemicals. Procurement and food and catering are also, I mean, this is all kind of procurement. Food and catering are also big contributors there. So there's, in using this information as a guide, an Ontario-based group called Peach Health Ontario, which is now based out of McMaster Hospital, created a graphic. Peach Health Ontario is an alliance of administrators and health workers, and it's focused on making more sustainable health systems. And so this diagram is based on a 200-bed medical hospital, and the peaches represent sustainable actions that can reduce greenhouse gas emissions. The y-axis is cost. So the low-hanging fruit are changes that actually save money, and the high fruit changes that are at least initially very costly. So, you know, obviously a new build is costly. The other dimension represented in this graphic is the impact of these different actions. You'll see that the fruit are different colors, representing how much of an impact each of these can have. Orange makes the biggest impact, yellow the next biggest, green the least. We're not going to have time to sustainability in healthcare, and I've kind of circled some of the ones we're going to at least allude to. But just you know, I think it's helpful for you to even know that this guidebook exists, and each of these different actions have their own guidebook and materials, educational materials associated, if those are things you wanted to move forward with. So as we mentioned, the supply chain is one of the biggest contributor, and within that, pharmaceuticals and equipment are major parts. We can use the circular economy principles to try to cut down on greenhouse gas emissions within those. So to refuse to not buy the stuff in the first place. So not buy single-use plastics, really consider whether we want or need merch or other programming or like stuff within programming. Reducing how much, if we need to buy it, reducing how much we do it, or so reducing our prescribing, reducing consumption-based programming, reducing our use of plastic. We can look at reusing, avoiding single-use anything, such as gowns, water bottles, and also recycling. So recycling plastic is not ideal. Only a fraction of plastics are ever recycled, and they can only be recycled so many times. But glass and metal are things which are more recycling friendly. However, an emphasis on refusing and not anything that we use, even if we recycle it, is extracted from the earth. So cutting down on consumption altogether is our first port of call. And procurement practices. So remember, that's the biggest chunk of the greenhouse gas emission chain. We can adopt values-based procurement and weigh sustainability in our requests for proposals and push our suppliers to go green. There's already Ontario hospitals that are moving forward with this, and Canadian Coalition for Green Healthcare has a guidebook on it that you can reference. Sometimes it's useful to reflect on just, where all those procurement greenhouse gases come from. Earlier this year, a study by Cower and colleagues, including Ontario co-authors, illustrated the emissions associated with prescribing. They documented the many steps required to extract resources, produce, and then distribute a clonazepam pill. As you can see, producing a single pill involves thousands of miles of transport between extraction, production, and distribution sites. The procurement and prescribing of pharmaceutical products is clearly a substantial contributor to an opportunity to alleviate greenhouse gas contributions. You can also think about sustainable prescribing in pharmacy, because you remember that's one of the biggest parts of the supply chain. There are programs and resources available to guide sustainable prescribing and deprescribing. So Choosing Wisely Canada is a program that helps to reduce unnecessary tests and treatments. Unnecessary tests and treatments expose patients to potential harms, they consume healthcare resources, and they contribute to the climate crisis. So, being trained within that model is a way to reduce our impact. The Canadian Coalition for Green Healthcare is a Canada-wide NGO. They have lots of resources, including newsletters. They host webinars. They have checklists and guidebooks to increase, to including and guiding prescription and reducing prescribing. And Cascades is another kind of major health climate organization. They are actually a coalition between U of T and Dalhousie and the Canadian Coalition, and they produce these resources. So there's a toolbox here, a guidebook there. And lastly, I just wanted to highlight a success story at Waypoint, amongst many, no doubt. But Amanda Otting is a pharmacist on Sans Souci. She had identified that a lot of the patients on our program were using sleeping pills, and advocated within the team to try and find other ways of addressing that problem. So shout out to Amanda. And so we started running an insomnia group. So thinking more of other ways, like more broadly about alternatives to prescribing. One important alternative is to prevent health issues in the first place. So we can think about healthy lifestyles such as exercise and accessing healthy food, which is also an HQO standard for treatment of schizophrenia, chronic disease management and self-management. In terms of symptoms, thinking of all the psychosocial interventions to address symptoms. So I've just mentioned insomnia, CBT for insomnia strategies, CBT and DBT strategies for other symptoms, including emotional dysregulation. Social prescribing, so there's robust literature that spending time in nature is calming and helps with regulation and is free and is also good for exercise. And another Waypoint shout out, like success story, is within the Awenda programs. They wanted to do some, like to manage, to help clients to calm down, and designed a room which is really low stimulation, has lots of natural images and calming sounds, including waves and that sort of thing. And there's robust research evidence as well to say, well, ideally spending time in nature is the most helpful, but even being exposed to the sights and sound, natural sights and sounds is also helpful, and that's what they've been able to do. There's programs where instead of there's social prescribing, meaning that patients are given prescriptions to spend time in nature as a way of calming and helping with their physical and mental health. In order to increase uptake of those alternatives, it would be helpful to improve or increase training so that people, staff are confident in using those and understanding them, and education campaigns and visuals and reminders to increase awareness for patients and staff, and the availability of these resources 24/7. And including it in quality indicators for our services. You may remember from that pie graph that procurement of food is a big contributor, and there's been research comparing the relative contributions of different kinds of food. As you'll see from this figure, meat-based foods are the greatest contributors in production, and whereas plant-based proteins are the lowest contributors. There's been lots of work done and resources available from those organizations that I are referencing. Whoopsies. About sustainable healthcare food systems. And the focus of, and these are based on 4 pillars. Number 1, food as medicine, just as we mentioned before. Preventing issues in the first place is one of our most powerful ways to improve health and reduce environmental impact. So, really taking food as medicine seriously, and encouraging that in programming, including introducing clients to plant-rich menus and menu items. Reducing food waste is very important. There's there's been research and surveys within Canada looking at how to reduce waste in hospitals. And I've included a reference there for easy and low cost strategies to reduce waste in patient food services. All kinds of stuff, including using menu items, doing food audits, repurposing food waste. Another success story at Waypoint on the vocational services. They're doing a wonderful job there. What they've done is, so they are, instead of just throwing out the food waste, they're using it within their vermiculture. And so only certain kinds of food waste can be used within vermiculture, but that's what they're doing. Patients are involved in that, and they also have a composting program, and I believe have visions of making that a commercial enterprise. Another important pillar within sustainable food systems is thinking about plant-forward menus. So in Vancouver, in Vancouver Coastal Health, what they did was they got in a chef who specializes in sustainable, like he's a top chef, specializes, very committed to sustainable healthcare. Between the chef and the stakeholders, they designed some really delicious menus, culturally inclusive. They added a lot of plant-based options to the menu there. And they found, they calculated the changes they've made led to a 43% reduction in greenhouse gas emissions from their food services. And there was high satisfaction with the food available. Hamilton Health Sciences has taken the Cool Food Pledge, which is a global initiative to help hospitals reduce the climate impact of the food they serve. So you set goals and you try and reduce your greenhouse gas emissions within the food by 25%. And as we'd mentioned, values-based procurement, meaning weighing, trying to shop local if possible, and understanding the business practices of where you're procuring from and weighing that in to whose services you make use of. There's a business case for a focus on food systems. So, for instance, plant-based proteins are 10 to 20% cheaper. half of food is wasted, and of all of hospital waste, like 10 or 15% of it is food waste. So there's lots of money to be saved there. There was another case study in New York. There was the New York City Health and Hospitals. There's 11 hospitals they piloted a study where they were offered exclusively plant-based menu, and again, paying attention to making the food tasty and appetizing. They found that there was very high satisfaction with the food, and there was less food waste. And there was just through the systems they used to reduce food waste, there was 6% less food ordered, which means, of course, cost savings. And over the 3 months, they saved about $500,000 US. That's over 11 hospitals. Another important way we can think about reducing our greenhouse gas emissions and environmental footprint within our hospitals is our single-use plastics. They're out of Hamilton. There's a couple of projects already undertaken to find ways and to study reducing single-use plastics within healthcare and reducing medical single-use plastic. The research that they've come to already is sort of shown that reusable gowns, for instance, reusable gowns were safe or safer than disposables, and that they can save money as well. Another some more success stories at Waypoint. We've had, there's a water fountain in the atrium, and there's another one being introduced into Tawanchi, which is great. So now instead of using plastic bottles of water, we can all be using reusable bottles. AAP uses these water urns, so clients are drinking water, which is healthier, and not using the single-use plastic. We can be environmentally protective in our clinical work. So we've already highlighted the wonderful work being done in vocational services and in Awenda, and no doubt other places. I'm just not aware. We started a green group on Sanssouci, which involved educating patients about sustainability and conservation. It involved in volunteering with a partner organization with Waimarsh. We designed activities that people with varying that could be done on site or off site. And involved them in trying to brainstorm ways of making Sanssouci per se more sustainable. And the feedback from the group was that they really appreciated it and found a lot of value and meaning from participating. So another important way in which health organizations and ourselves as health workers can contribute to reducing our greenhouse gas emission is through finances. The pension funds are a way to move millions of dollars away from investment in fossil fuels and toward renewable future. This group here is Canada-based, Shift Action, and they have a specific department, if you like, to do with Hoop pension, and they are strongly advocating to Hoop to fulfill their fiduciary responsibility to shift away from fossil fuels, which are going to destabilize the economy, to investment in renewables. And they have various mechanisms for doing that. They produced a health card. So within the pension health report card, I should say. So for instance, Hoop got a B- in terms of being Paris-aligned target. Their investments were aligned with the Paris Agreement. They got a D for climate engagement, etc. There's sort of various measures within which they've compared pension funds across these, and including HOPE. There's resources available through Canadian Centre for Green Healthcare to encourage our hospital foundations to make more sustainable investments to protect both financial and health of our communities, and other guidebooks. Universities have also been involved in activism regarding banking and getting banks off campus that are heavily investing in fossil fuel industries and ignoring Indigenous rights and communities there. Research and conferences. Another way we can contribute as workers within a health organization. We can collaborate with existing efforts such as Cascades or the Canadian Centre for Green Healthcare. We can consider the climate impact of research, including placing a sustainability lens on ethics clearance, to kind of say how much, like how climate intense is this project, and is this beneficial enough to justify that? When we're running or attending conferences, we can think about ways to do that in a more environmentally protective manner, such as having virtual options. I know, like the Scientist Rebellion group and other scientists within Europe refuse to fly. Like I guess they and they have a system for prioritizing. Okay, if it is an international conference, we should only fly just so much. Like, so either refusing to fly or really like rationing it, having systems for that. There's this graphic here, just sort of shows the difference in greenhouse gas emissions in person versus virtual conferences. So having virtual options is very important, and really considering whether flying in Canada, it's a bit different. We don't really have the infrastructure, the train infrastructure that Europe does, but nonetheless, flying is very carbon intense. There's an Australian academic who refuses to attend as a step, sort of out of conscience, refuses to attend conferences that don't have virtual options. So including virtual options, including plant forward menus, cutting down on unnecessary purchases like merch, or like taking them, making them available. Every year at the CP, at my national conference, I'm handed a tote bag, which is made of, some sort of plastic derivative. It's like, I don't need that. It would be good to be advocating to my organization not to be producing those every year. So the catering policies, including beverages and plastics and how those are all packaged. And funding, and another Waypoint success story I wanted to shout out is the WRI, who were willing to back the research that I proposed, and I worked on that, and that's part of the Green Group evaluation and other stuff that I've been able to do. I think that is it's a sort of a non-conventional focus of research within this context, and they were willing to do that, and kudos to them. And within research context, joining groups such as Scientist Rebellion, although that might be outside of a work context, of a paid work context. So how are we going to do it? I wanted to actually just include this picture. This is Pollinator Garden, another shout out to our grounds staff who there's a beautiful pollinator garden on grounds here, and we're really lucky to have it. And we've used it within the Green Group to go and just enjoy the outdoor space. So in order to make changes like this, there are change management models. Other people would be more familiar with those, like in management than I am, but obviously we would want to be using those. research suggests the most important things when making these kind of changes is making it easy. So using the resources that I've already alluded to, making it the default. So it's not an add-on, it's just like policy, like it's policy that we only ever have jugs of water, not individual plastic bottles, or, whatever it is, including it within policies, WIGs, agendas, strategic plan. Strategic plan is sort of, we're perhaps hopefully in our next strategic plan. So making it easy and making it rewarding. So setting goals, having winnable changes, making it social. And I've been lucky to be doing a lot of work with colleagues, including Barna and the Sanssouci team, and just all kinds of colleagues. And I've met just some really awesome people in this. And any innovation, of course, it's not a good idea to be the hero innovator. We have a lot more fun together and we get a lot further. So what could your role be? It's helpful to think about what you're passionate about, what is needed. So like what will actually have an impact, and what you're good at or paid, or what's part of your role, what's part of your job, what are you required to do? And where those three intersect, maybe that's your role. So whatever our role is, we're wanting to get involved and not just kind of say, oh, you're so inspirational. The protecting the environment isn't all about interests, and it's all about responsibility, I would argue. And it will take all of us to get on board in order to make the changes that are needed. Just a reminder of all, in terms of what we can do, those many different roles, thinking about those. Some practical things, I would say: join, actively support, learn from these organizations, which are, so Canadian Coalition, there's Cascades, the HOOP organization, and Peach Health Ontario, all kinds of awesome resources there. And outside of work, you might want to join your professional organization. There's one for physicians, but it includes any kind of health professional. There's a nursing one, nurses. There's a pharmacy one, and then there's also Scientist Rebellion and Scientists for Global Responsibility, for instance. Again, there's lots of resources. We don't need to start from scratch. What's important in any of these efforts is to make it joyful and to find community. Dan Savage in the AIDS crisis talked about, like, during the dark days of AIDS crisis, we buried our friends in the morning, we protested in the afternoon, and we danced all night. The dance kept us up in the fight because it's a dance we were fighting for. It didn't look like we were going to win, and we did. Doesn't feel like we're going to win now, but we could keep fighting, keep dancing. So, I mean, that was part of the AIDS crisis, and but the principles apply within environmentalism, is like find community and find joy. And if you're interested, email me and we can get moving. So we have a chance to make a difference in this short moment in history, and action is the antidote to despair. All right, so now I'm going to let Barna take over.
So, my name is Barna, and I'm a research and clinical psychologist at Waypoint. As you may know, I work part-time for the WRI and part-time in different clinical roles, both at outpatient services and regarding CBT for psychosis across the hospital. My journey started a bit differently than Caroline's. I was introduced to environmental stewardship pretty early. I'm originally from Hungary, and this is where I was growing up, and I remember a big milestone in this regard for me was a beautiful album of stickers edited or published by the World Wildlife Fund. And I was in my elementary school years, and it was a really beautiful album, tons of stickers, kids would love it, as you would imagine. And it was filled with beautiful images of animals, plants, and so on, but the last few pages was about pollution and environmental degradation, and that was the first time when I recognized the severity of this issue. And then I was living in a rural area, so we had a chance to engage with nature in many different ways. One of them was collecting garbage in the woods. And this also formed my understanding of how to deal with these issues, how to engage people, motivate myself, and find community and also some pleasure in engaging with climate stewardship. Also, for a brief period of time, I was politically very engaged, meaning that I was a candidate for the Hungarian Green Party on the municipal level. I failed, but anyways, I tried, and because the voting system is different in Hungary, the partial votes also counted and contributed to some success and delegates reaching the municipal council. So that was also a formative experience for me. And then I arrived to Ontario, and Caroline was a big boost to my environmental stewardship with all her energy and enthusiasm. She involved me and some other colleagues from the beginning, and this is where I am today. So my topic within this presentation is a bit different in the sense that Caroline's focus was on how to prevent the further degradation of the environment and worsening of the climate crisis, while mine rather focuses on what to do in terms of the damage already done or that is yet to come. And we know that we do not know exactly what is going to happen and when. So there are different scenarios and predictions depending on how our societies will work and how much committed they will be to reduce our greenhouse gas emissions and other pollutants. And there are more positive scenarios, which you can see in the lower lines in this graph, which fall into the category of climate revolution because it would require us to substantially change our daily practices. It would require us to not just change how we consume, but reduce our overall consumption, which is called degrowth, and overall reduce our environmental burden, which would most likely contribute not just to the maintenance of our societies, but actually improving them in terms of equity, justice, and a fairer redistribution system. On the other hand, the current status quo is the red line. So if we do not change anything, then the outcomes that can be predicted from the current trends are pretty negative. And it seems that by the middle or by the end of the century, continuing with the status quo, there will be permanent crisis, genocide, famine, social collapse. And this is a scenario based on global warming temperature of 3.3 to 5.7 degrees. And it seems that even a 4-degree global warming is incompatible with an organized global community. Even if we consider our current global state as organized, this is what's not sustainable if it will be even warmer. And so what I have just described in the previous slide is mainstream climate science. So that's not outliers. And now I would like to talk a little bit of an outlier. This researcher is called Jan Bendel, and he was a sustainability researcher for decades for the UN and large corporations, and tried to help them to change their practices to become more sustainable. And after doing this for decades, Bendel took a whole year off to review the raw data of climate science, not the government reports, not the brochures, but the original scientific data on how we are doing. And his conclusion was that actually there's no way we can change things around, and because we have already passed key ecological tipping points, so we have already logged in so much damage into our climate that we cannot change course. And so our societies will collapse in the near term, most likely. He even says that that it's not just going to happen in the next 5 to 10 years, but it has actually started. He described this entire way of thinking and all the data he relies on in this book, Breaking Together, which I think was published 1 or 2 years ago. It's a pretty thick 500-page book, the first half of which provides data to support his argument, while the second half deals with, okay, then what? What shall we do? So in his interpretation of the data, the collapse, that is the disintegration of our societies, are actually already underway. It has already started, and but it will certainly become or can become much worse, and it means breakdown in financial systems, food and other supply chains, public services and governance in the near future. So not in 2060, not for our grandchildren, but for us in the next 5 to 10 years. And it's also important to note that yes, while the climate crisis disproportionately affects the disadvantaged groups of our societies, what Bendel predicts is that this collapse or disintegration will reach the masses in the West, including the middle classes. So it's not just a problem of developing countries and the poorest of our societies. So again, Bendel is an outlier, and he is not the mainstream at this point, which does not mean that he cannot be right. No one knows at this point. But if he's right, then it means that we should devote some energies or relocate some energies from trying to prevent or stop climate change and the affiliated social collapse, and devote some energies to the question of how do we adapt to the unfolding collapse in every regard, mentally, practically, spiritually, to reduce our own and others' suffering and preserve our dignity and build resilience in ourselves and others. And to aid this process, he developed his deep adaptation framework, which is not a set of smart answers to these problems, but a set, I think, of good questions that could help us think about this issue. So the 4 pillars of this system includes resilience, which is about what do we most value in our current social structures and which we would want to keep, and how can we keep it, even if many of our systems will no longer be operational. The other one is relinquishment. What do we need to let go of so as not to make things even worse? Typically, this is about how to reduce our consumption and daily habits, that it's less destructive or just more possible considering a collapse. Restoration, that is, what could we bring back from our past to help deal with the collapse, whether it's ancient indigenous practices or just our grandparents' cooking book. And finally, reconciliation, what and whom shall we make peace with as we awaken to our losses? Meaning, how do we deal with the loss which would come emotionally, which would come from the collapse of our current social structures and way of life. Again, this is not a comprehensive list. This is just a few ideas to make a point and could give you a sense of how this way of thinking could look like and help us. I would like to bring a few ideas what this would mean for all of us as Ontario residents, including clients, us, professionals, and the general public. So, for example, supporting local food production and distribution could definitely and very clearly increase our resilience, because then we wouldn't need to rely on food resource from the other end of the world. So anything we can do to support local farmers and the systems that are set and available even right now that connect farmers, so food producers and consumers, supporting all those systems would be a good way to increase our resilience. Also participate actually in local food production and distribution could be also helpful, whether it's joining a community garden or just in our own yards, to get used to the idea of make our hands dirty. Learning basic life skills would also increase our resilience, including cooking from scratch, learning basic home-based food preservation practices, first aid, and so on. As some of you may know, I also have an interest in nutrition and mental health, and just I think it's important to point it out that even if Jem Bendel is wrong and the like-minded, for example, eating less ultra-processed foods and producing our own food, preparing our own food, would be very beneficial for our general and mental health as well. So many of these things are helpful anyways, even if Jem Bendel is wrong. Also, reducing our dependency on global supply chains by building repair, barter, and sharing systems would significantly decrease our reliance on global supply chains and the vulnerability that comes with it. So if instead of buying new, we learned how to repair things, we demanded producers that they make their products in a way that are reparable. There's a movement in Canada, and in Canada it's just started, but in the EU it's very strong now, the right to repair movement, which demands producers that they provide manuals which allow people to repair and that they produce the parts that would be necessary to repair. Sharing our goods instead of purchasing them individually would also reduce our consumption and dependency on those distribution systems, the global distribution systems. Also, support and participate in any community and community events would be very important to reduce isolation and anxiety, both our own and others. And again, this is, we know that humans are hardwired to be part of communities, and we know that in the past century in the Western societies largely increased the sense of isolation and loneliness, which is now a public epidemic, as announced in the US by the Surgeon General. So reducing isolation and investing more time, money, energy into building communities is good. and would be necessary even if Jem Bendel is wrong. But if he's right, then these communities would be absolutely necessary for helping us to survive mentally and emotionally. Similarly, building small circles of trust where people can help each other and be able to learn how to better tolerate and process loss, discomfort, and change. This is how people have been coping for thousands of years, and at this point we would need to rebuild some of those structures to support ourselves and each other. So this is about just a few ideas what Bendel's framework would mean in general for everyone in society. While in the upcoming 2 slides, I would like to bring up a few thoughts, what can it mean for professionals, healthcare professionals. So for example, this preparation could mean that we put a bit more emphasis on community versus hospital-based care, because hospital-based care is always much more resource intensive, more expensive. And in these efforts, we can or may want to improve or change a bit the focus of our repertoire and put bigger emphasis on meaning-making interventions. Again, humans are storytelling species, and especially in crisis, in hardship, people need to be able to create a narrative, a coherent narrative to their lives and their challenges. And those interventions which could help them with this could be beneficial in terms of coping with a social collapse. Also, bringing back traditional indigenous wellness practices and support nature and mindfulness-based interventions, which are easy to access. They do not require many resources, either financial or expertise, would be helpful and practical in such a context. Also, increasing the availability and mobilizability of non-expert supports would be helpful and practical, whether those are peer support models and resources or the lay public's mental health skills. So for example, even today there are simplified trauma treatment protocols in use in developing countries. We may want to learn from those practices and be prepared. Also, if we go back to the specifics and perhaps even considering the hospital-based care, we would need to, in preparation for a potential degradation of our societies, develop or maintain our ability to operate without EHR or the internet or artificial intelligence, because these might be less available if our societies fundamentally change for the worse. Also, if possible, we would need to be more conscious of which medications we use. Caroline talked about this extensively, and it's not just about the resource intensiveness which contributes to the degradation of the climate, but it's also how resource intensive is to get those medications. So if we have less resources in the future, even less resources, then we may want to prioritize medications which are less resource intensive to produce. Also prepare that we would potentially need to make hard decisions on whom to provide care and whom not to provide care. And we know from the COVID era that this moral injury can put a big burden on healthcare providers. And so we would need to prepare for this on the long term if our societies go downwards. And I would go back to the first slide for a bit, in the sense that I would like to emphasize that these are not categorical, completely separate scenarios. this is a continuum, so each decimal degree of warming or non-warming makes a difference. So we would need to make an effort to try to prevent as much as we can. And I would also like to point out that even though we separated a bit in Caroline's and my presentation what is about preventing the negative outcomes of climate change versus how to adapt to it, many times the practical activities that support one is also supportive of the other. So just think about some of the examples I mentioned, whether increasing our reliance on local food production and distribution, or repair and bartering systems and so on. These would not just help us become more resilient in case of a social collapse, but they would also contribute to the prevention of further worsening of our climate situation. So even if John Bendel is wrong, then I think there are many things we could learn from this thought experiment and make our lives better. Again, just think about increasing community involvement, for example. These are absolutely necessary for our mental health, and we know now even our physical health, and that would require investment, all kinds of investment, even if our societies will not collapse. So thank you so much for your attention, and we are happy to take on questions.
Thank you so much, Carolyn and Barna. That was great. I just want to highlight, Carolyn, when you were giving some examples at Waypoint, Caitlin mentioned that Outpatients runs a sleep hygiene workshop on a monthly basis, which is great. And she also has a question. So much of our funding is tied to traditional medical model or business model. Do you have any recommendations on how to advocate or circumvent this?
So I would say also that like a lot of psychosocial interventions are so evidence-based, like CBT for psychosis, or mindfulness-based depression, or treatments for depression. And as I mentioned, the HQO standards, which is for schizophrenia, include healthy eating and exercise, which are climate protective and non-pharmacological. So I guess I would start there with making the case that evidence-based interventions, there's psychosocial ones as well. I don't know if you have anything to add to that.
I would just say that I think that's a very fair question, and I'm sorry, I'm afraid that we will not be able to make progress without investing time and energy into advocacy and push. And this is why it's important to join organizations to be able to increase our chances to actually make an impact on the policy level. And that can only be done in organized ways as part of larger organizations, and it will not be possible, I think, through individual initiatives. Yeah.
Great, thank you. I'm not seeing any other questions just yet, but maybe I can ask one. So you both gave some great examples of ideas of how to integrate climate action and sustainability into your work. I'm wondering if maybe you each can provide one example or expand on something you've already touched on of how you personally are integrating this into your work.
So one of the ways I didn't already touch on was in my role as psychology training lead. Part of that role is to provide, to take a share in delivering didactic seminars. And I presented at a national conference for that to all psychology learners, to psychology residents. So they're the learners who are just on the cusp of finishing their PhDs and becoming fully qualified. So I did that and sort of took a frame like the ethics and the ethical responsibility. Like I framed it as part of our professional role. So it's consistent with our ethical code, which includes a responsibility to society. And it is included in our core competencies, which include advocacy for social determinants of health. So I did that. I'd like to move forward with that, in a more concrete way beyond just didactic presentation. And I published within that as well. And then I did the clinical group on Sans Souci where I work, and trying to encourage like the whole community, Sans Souci community, including clients and the team, to kind of work together to make Sans Souci more sustainable.
First, I think I would bring up a few very simple everyday things, like that I commute to work by bike whenever I can, whether it's in Midland or in Penetang. Also, whenever I can, I just go on foot, and when we need something from the grocery store and the kids want to come, then we just go on foot, and sometimes they hate me for that. But anyways, it's an important way of giving an example and show that it's possible to go to the grocery store on foot even in the winter, and we will not die. And actually, it's good, some fresh air and so on. And in terms of bigger things or more strategic things, I follow Shift Actions directions and
Yeah,
their
that too.
announcements, and I try to, every time when the pension plan, or I mean HOOP, puts out a survey to members, then I try to let my voice heard, that what are my preferences in terms of investment for the future. I coordinate with some people who are available, and we do the same. And yeah, I think advocacy also. Caroline organized a meeting with our MPP, on which we participated, and we try to share what are priorities in terms of climate stewardship and so on. Some of these are uncomfortable and can bring up just discomfort, tension, whatever, but it's part of the game. I mean, changing the status quo of large system is brutally hard, no matter what it is about, and this is about everything, our entire lives. So it will not go without effort and discomfort, but I think it can only bring absolutely pleasurable experiences, meaningful connections with nature, with each other, whatever. So there's a trade-off. I think there's a positive outcome of it as well.
Absolutely. Thank you both. I'm seeing a couple similar questions in the chat. So are there any groups or organizations locally that you recommend? And then looking to expand on if there's anything within Waypoint, and Carolyn, what that group might look like.
So there, the groups, the local groups that I'm aware of are outside of paid employment. They're like to do, there's Greens, there's Green Aurelia, there's Simcoe, there's some Simcoe based groups, Highway 413, those sorts of things. The health-based ones are the ones I mentioned, like there's Peach Health Ontario, and then there's the Canadian-wide ones, which are Cascades, and Canadian Centre for Coalition for Green Healthcare. Within Waypoint, there's nothing official as yet. So it's possible to advocate within your teams. And I left my email there if we're wanting to try to do something Waypoint wide. We'd need to kind of go up the ladder to get approval for that. But yeah, we can get started on that now that I don't have to prepare this webinar anymore.
It's interesting. I remember that there used to be a green group at Waypoint, and they had all kinds of recommendations, but I do not know whether it's still
It's not
um,
still running. Somebody
it's not
left.
anymore. Okay. But I do not know if there was a specific structure attached to it, or it was a completely a grassroots group without any formal authorization. But anyways,
I believe it's grassroots. In Hamilton, when what they did was start as a grassroots, like hospital-wide group, and people kind of what they were passionate about, like people joined together, and somebody was passionate about trees, and they did a lot of tree planting events on grounds there. Someone else was passionate about food waste, and they did work there within the kitchen, and like people followed their passion and influence, but they would meet together just to kind of encourage each other and to kind of put their heads together and do that. We've done a little bit of that at Sanssouci, but yeah, it's as Barna's mentioned, system change takes time. I do appreciate the kind of organizational support I've got. We've had so far in all kinds of ways, but yeah, it's like a systems change, and there's logistical challenges, but they can be overcome. We just need to work at them.
Great, thank you. I think there's two other questions we probably have time for. So do you have any recommendations for people looking to increase plant-based food consumption that we can share with our clients and use ourselves?
There's a group called Nourish that seems to be like involved with the health systems, plant-based sustainable food systems efforts, and they have tasty recipes, for instance, and Canadian Centre for Green Healthcare have guidebooks about increasing use of plant-based food. There's sort of tricks and about increasing palatability. So number one, choosing good recipes. Number two, when you're trying to encourage plant-based eating, making that the default. Making inclusive, they call inclusive menus. So it's not like, well, vegan food is over here and then the so-called normal food is here. And more like, all right, we're going to have food that's suitable for gluten-free and is vegan, and is suitable across cultural or religious practices, and making it taste great. And like describing it according to ingredients rather than describing it according to exclusionary. So we don't call it vegan, we say, ginger carrot soup, or ginger with a sprig of rosemary, or that kind of thing. Putting it higher up on the list is another strategy that's been used and promoted. So when you put the plant-based at the top of the menu, it's more likely to be selected. Yeah, those are just some of
That's
the
great.
Mhm.
That's great, thank you. And I think there's lots of suggestions that were just added to the chat as well, which is great. But Barna, did you have anything to add for that, or should we move on to our last question?
let's move on to the next question because we do not have a
All
lot of
right. Yes, sounds good. So the final question from Stephen is, within a hospital, are there typically formal evaluations that look at how to reduce waste, or any other formal mechanisms that you're aware of that address possible waste?
So I'm aware that those tools exist. I'm not sure if we use them here, but there are lots of tools available, including in food waste systems and doing food audits. There's tools for evaluating procurement, so there's already kind of lists for large companies, but there's also toolkits and questionnaires like to evaluate if you're buying from smaller companies to kind of try and get a sense of their sustainability. There's all kinds of questionnaires and so forth. The Canadian Centre for Green Healthcare have all kinds of questionnaires. I'm just looking around my desk that help with checklists and give you ideas for like specific ways to make changes or what to focus on. and those systems where you kind of set goals and monitor them. Like we already use those systems here. It might not be about food sustainability, but or other sustainability, but we certainly use those systems, and we could add these sorts of items if there was enough political will.
Anything that you want to add there, Barna?
No.
No? Okay. Well, wonderful. Thank you both for the great presentation. Thank you to our audience for all your wonderful questions. We just have a few closing pieces. So the recording and slides will be available on our website after the event. And again, we ask that you complete that post-event survey. Sharing your feedback just helps us improve our future offerings. And if you would like an attendance certificate, please feel free to reach out to me via email. I'm happy to send that your way. So we'd lastly like to promote our final Waypoint Talk session of the year on December 9th with Dr. Ann Crocker. So we will be discussing reimagining forensic mental health research for a changing world. And if you'd like to register, you can scan that QR code. You should also receive some emails about this session from us very soon. So thank you so much for joining us today. Thank you so much, Carolyn and Barna, for a wonderful presentation. And we look forward to seeing you soon. Take care.
Thank you. Bye.